President Trump is pushing for changes to the childhood vaccination schedule. He signed an executive order today that would lower the amount of recommended shots for kids and would separate the vaccine for measles, mumps, and rubella into 3 different shots across 3 appointments. Doctors in Colorado say the president's words and actions could deter families from getting their kids vaccinated.
This comes as measles cases around the country are at a 35-year high. 9 News reporter Rachel Kraus joins us now. Rachel, doctors say the president's order is creating some confusion.
Yeah, the CDC's own website says diseases like measles, mumps, and rubella are still here, and people who decide not to vaccinate their kids put their own children and others at risk. But today, the president called to split up the MMR vaccine from 1 shot into multiple, and at the same time calling for fewer vaccines for kids.
On a visit to the doctor, vaccine discussions are routine.
Yeah, so it's definitely almost a daily topic that we're always talking with our patients about, for sure.
Lately, so is pushback on the science that supports it.
Yeah, I would say a lot of times they come in a little bit closed off and maybe a little bit defensive because they know that we're probably going to recommend them.
Dr. Corey Line is a family physician at UC Health. He says this is the time of year when kids should be getting caught up on immunizations before heading back to school. But after President Trump signed an executive order Monday that would cut the number of required vaccinations for kids from 18 down to 11, Line worries that vaccine hesitancy will climb.
Yeah, it could be a potential another barrier, as we have already barriers around information that's not accurate and confusing patients and families.
The measles, mumps, rubella shot is given as 1 vaccine. The president wants to split that up, even though individual vaccines aren't approved by the FDA or available.
It doesn't make sense to me, and I would not want my child to receive its vaccines that way. And actually, your immune system does better with those combined vaccines because it's able to take those, start building your immune system, learning from those vaccines, and it does that at 1 time versus at 4 individual times.
The push to split up MMR comes as measles cases are climbing.
Absolutely, yes.
State epidemiologist Dr. Rachel Herlihy says they're at the highest level in 3 decades.
Unfortunately, nationally, we've now seen a record number of measles cases, the most cases that we've seen in the U.S. since 1991. And the trend is pretty similar here. Last year and this year, the number of cases that we're seeing are really numbers that we haven't seen since the early 90s.
She says with measles cases expected to keep rising, they need more kids vaccinated, not fewer. Lyon says that will mean more conversations with parents about why these shots are still safe and trusted.
These are 100% preventable diseases. You know, our goal as physicians and as a community is to prevent those diseases.
The State Department of Health tells me that the executive order does not change the state's school or child care requirements for immunization, saying in a statement they will, quote, continue to base its vaccine recommendations on the best available science and ensure Coloradans have access to safe and effective disease prevention tools. Rachel Kraus, 9 News.